low back pain. So low back pain is a leading cause of disability worldwide, and I would divide it into two perspectives. One is Western perspective, which is more of a mechanical and inflammatory type of understanding the problem, whilst the Eastern Asian medicine interprets those symptoms and puts them through a lens of like qi deficiency, blood deficiency, meridian disruption, and organ deficiency. Low back pain is global epidemic, which studies confirm, with over 577 million people suffering from low back pain at any given moment. It's more likely than not that you or someone you know had low back pain in recently. Studies tell that low back pain peaks about from the age of 40 till 69, but it's more often than not that even younger people suffer from it. It's more prevalent in highly developed countries because of the way we live, the jobs we do, which are more sedentary. We don't eat properly, we don't move, which is also some of the risk factors, including stress and obesity. And that takes a high social economic cost to society, because you cannot work, you cannot contribute to society, and it's a burden to the healthcare system. Pathology of low back pain in Western medicine is structured around structural degeneration of discs, stenosis of joints, and strain on ligaments. Can be followed with inflammation, neuropathic pain with compression of nerve roots, and all of them can be accompanied with anxiety of movement, fear of movement, and if pain persists long enough, it can lead to depression. The Western approach to treating this depends on the person you ask, the medical professional you ask, whilst surgeons, like neurosurgeons, are more prone to corticosteroid injections and surgery in general, with the aid of non-steroid anti-inflammatory drugs, opioids, or antidepressants. But my personal choice is education of patients about their condition, exercise, what they can do at that given time, some manual therapy, like Tuniel, it's like a form of a massage, or some spinal manipulations. We can use different approaches to treat low back pain in Eastern Asian medicine. We can use traditional Chinese acupuncture, which is meridian-based on local and distal needling points. We can use the Dr. Tom Balance method we learned here. It's a 6-system method with a distal approach, with no needling on the tender spot, whilst trigger points use needles to insert into muscles on muscle knots and try to release them and get an anesthetic effect. We can use electroacupuncture, which is using low intensity electricity on the needles, so we can get muscle relaxations. We can also use auricular therapy or sujok, and the junk techniques, which are not technically needling, but are used in adjacent to needling, which is cupping, tunia, and moxibustion. When our patient comes in our office, we have to do an examination, of course. We do 4 examinations, which is inspection, smell, inquiry, palpation, where with inspection we see how he walks, how he stands. We can inspect his tongue as well. Smell is not so prevalent here, but can give valuable information. Inquiry, we do a questionnaire. How long does the pain last? Does it get worse or not? Palpation, we can palpate the tender spot, and we can palpate the pulse, so we can get more information about his current state. And we use all of that info to make a pattern differentiation. So it can be either stagnant qi or blood in blood. It can be kidney deficiency, or it can be cold damp obstruction. For cold damp, for stagnation of qi and blood, the symptoms are sharp stabbing pain that's located at the low back. It's worse at night, usually is followed by a history of trauma to the area. The tongue is dark and purple because the blood doesn't move. The pulse is choppy and wiry. So we use some local points like bladder 23 and bladder 25 to get some local pain relief, and we use distal points so we can establish movement of qi and blood. We also implement spleen 10 to remove blood stasis, and hegu for movement of qi and general pain relief. Kidney deficiency manifests as dull, aching, and chronic pain. It's better with rest, worse with some movement. It can give symptoms in the knees, such as weakness. It can give general fatigue, tinnitus, cold limbs. The tongue is pale. The pulse is weak and deep. We also puncture locally on bladder 23, governing vessel 3 and 4, because we want to tonify the kidneys to root the lower back. Bladder 23 and governing vessel 4, Mingmen, is to strengthen the yang. Kidney 3 strengthens overall kidney energy, while bladder 52 and Ren 4 add support for essence. Distal and local needling balances and restores the spine's foundation. When cold damp obstruction, it's a heavy, stiff, cold sensation in the back, which is obviously worse with cold weather, better with warmth. It has limited mobility, the tongue is white, greasy, and the pulse is deep and slow. So the reasoning behind this is because we want to warm the yang, expel the cold and damp, unblock the channels, local points relieve lumbar pain, but while the spleen 9 and stomach 36 resolve the dampness, and we can use moxa, that's mugwort plants, to warm the local points on the lower back. We have clinical evidence of this. There's meta-analysis for acute and chronic low back pain. The one for acute is we have 14 studies with over 1,200 patients, which indicate that acupuncture was 12% more effective in comparison to oral medicine, such as non-steroid anti-inflammatory drugs. For chronic low back pain, a randomized meta-analysis of 29 studies showed that over 17,000 patients reported that acupuncture works as a treatment beyond placebo and has effects even 12 months after treatment. Long-term benefits are that with incorporating exercise into acupuncture, we improve the overall health quality in subsequent follow-ups. And if we include electroacupuncture, we stimulate serotonin and norepinephrine release, which reduces our dependency on medication. My conclusion and some future direction of research is that while Western medicine excelled in diagnosing and treating structural causes of low back pain, it often, such as herniated discs or spinal stenosis, it often falls short to managing chronic non-specific pain. Eastern Asian medicine and acupuncture specifically offers a complementary approach focusing on restoring system balance, addressing root causes of pain, integrating care models, combines strength of both worlds, such as using imaging and pharmacology to treat acute conditions. And acupuncture is like an addition to treating chronic states. And for the future of low back pain management lies in personalized care, standardizing protocols, improving practitioner training, improved medical staff knowledge of medical staff, because not everyone is aware of its benefits to treatment, and more scientific study is also needed to give us more information on how we can use it even better. And that would be all for me today.
Thank you very much, Werner.
Yes.
So now I would like to ask Stella Kapoulou, physiotherapist from Greece, to talk about the same subject, the effectiveness of acupuncture in non-specific low back pain.
Hello, everyone. Thank you very much. Let me share my... Okay, so can you see it?
We just see the
sorry.
part of your, so maybe you need
sorry.
the whole screen or something.
Yeah. Okay, so the effectiveness of acupuncture in the non-specific low back pain. Non-specific low back pain, as we all know, is pain without a clear etiology. The chronic NLBP lasts over 3 months. It has also non-recognizable etiology. The guidelines suggests acupuncture as an alternative technique. So the 85% of low back pain, some epidemiological data. So 85% of the cases are non-specific. The 18% in the last 10 years has increased. There's a high healthcare burden, and the risk factors come from the lifestyle, trauma, posture, and occupation. Some pathogenesis and pathophysiology problems that cause this complex syndrome, let's say, is the prolonged muscle tension, such as prolonged single bending posture, muscle overload and imbalance, which resulting in a cumulative strain injury. As a pro-inflammatory factors play important role in its development, and the sterile inflammation and of the muscle and fascia due to swelling and pain lead to nerve irritation by applying pressure on the small blood vessels and nerve endings, which leads in turn to clinical pressure points in certain areas of the body. So modern treatments include drugs such as surgery and massage therapy, a laser therapy in order to release pain and muscle tension. But the problems coming out of these are more side effects and which have usual limited relief of the pain. Acupuncture has been used for over 2,500 years. It's focused on meridian, and T-flow, and targets to pain relief and balance restoring. Um, um, uh, the modern acupuncture application is most commonly used the acupuncture, moxa, and cupping, along with cupping. These have low side effects and are mostly cost effective, and are widely performed not only in the East but also in the Western world. In Chinese medicine, it is said that the cross loop is over the large meridians, making them inaccessible. Therefore, pain relief is an important target for NLBP interventions. Now, oops. So drugs, the conventional VSD acupuncture therapy, we have the drugs like NSAIDs, corticoids, opioids like non-steroid, paracetamol, antidepressants, which have side effects, costs like addiction, drowsiness, dizziness, allergic responses. Also, having a spinal surgery, on the other hand, often can also be an ineffective way of treating this problem, usually. Whereas acupuncture proves to be more effective and safe as a non-mainstream health practice and method used with along with conventional medical care in order to enhance its effectiveness. Some clinical evidence out of a German study that showed that acupuncture can be more effective than conventional therapy. And the meta-analysis led to the conclusion that acupuncture is more effective than no treatment. And that's been recognized by WHO, acupuncture for the LBP, since 2002. So let's go on to the common acupoints for low back pain. Here are the we see which are the most frequently used acupoints for LBP, using both local and distal points of the bladder and gallbladder meridians. In the upcoming slides, there's a diagram. Here's the diagram that demonstrates the links and the amount of effectiveness. That's actually, here's the diagram where the most prescribed acupoints, with the ones with the best results, and the most effective combos out of these are the BL23, BL40, BL23, along with BL25. So comparative approaches. We have the comparison of different acupuncture styles, the outcome of which that is the hand-ear acupuncture is where is most effective in the long term, and has more benefits to offer to the chronic non-specific low back pain. So here are the mechanisms of the action. These acupoint selection and outcomes. Sorry. Sorry. Okay. Oh, just a moment. Okay. The purine-mediated effects, the ATP and adenosine, the neural pathways are playing an important role in pain relief, but yet there's still more research to be done. And the conclusion out of this, it is shown that although acupuncture seems to be an effective, safe, and a cost-effective method of treatment, it is best used as a complementary, mostly, therapy. Because of its significant role in the long-term management of non-specific low back pain. Thank you for your time.